Sawadika, this is your host, Kusuma Yothasmut. Welcome to Thailand today. Aging society has emerged as a priority in Asia, including Thailand. So in the year 2014, about 15% of Thai population, or about 9 million, were elderly people. So almost a third of Thailand's population would be over 60 by 2050, according to the United Nations. Aging is the beginning of a negative cycle of inactivity, poor health, illness, and even mental problems. But there are positive reasons to say that aging can be a blessing in disguise. With the assistance of the health experts, elderly people can adjust to the challenges that come with aging, and they're more likely to continue enjoying their life. Thailand Today will speak with Dr. Wanviput Santasitwong from the Vital Life Wellness Center, Bamrungrad International Hospital on preventive and regenerative care for elderly people. Please welcome to Dr. Wanviput Santasitwong. She is from the Vital Life Wellness Center, Bamrungrad International Hospital. Sawadika, Doctor. Thank you very much.
Sawadika. Thank you very much for inviting me here.
Pleasure. And then you are the one who have to tell me about anti-aging, which I'm looking for that also.
Definitely, because right now I believe that most of the people in the society, I think maybe all over the world, we are afraid of getting old.
Yes. So we are talking today about the wellness and anti-aging. What does it mean? I mean, from now on, we are going to, nobody died? How do you manage with that? What is it actually?
So actually, I would like to start with the definition of anti-aging or wellness. As you may know that the concept of anti-aging is quite popular for the past couple of years. The reason is like I mentioned earlier, most people are afraid of getting old. Why? Because when we talk about old, the image of old people gonna give you, for example, they're gonna think that it means the skin is shrinking, have many lines, the energy is going down, and also the increasing is a lot of complications and disease and illness. So pretty much that means old people have pretty much poor quality of life. That's why people say, I don't want to get old. But as you may know, the trend of the life expectancy of the population, not only in Thailand, we are getting live longer and longer and longer. But still, we still have the retirement at age 60s.
Yes.
So by the prediction in the few years, in the futures, actually Thai societies might turn into the aging societies because we have a lot of people who live longer, above 60 years old. So that's going to be our goal, that how we can make this population become healthier and also still very productive, that can contribute to the societies. I think that's why that's the concept behind the anti-aging medicine or wellness medicine. Pretty much is about how to maintain the quality of life, no matter how old you are. And maybe for some Western population, they looking for the way to live forever. But for the Buddhist people or most of my patients, I think for Buddhist people, we don't want to live forever, but we want to live until the age that we're supposed to pass away, but we want to pass away gracefully and still like healthy and active, not like spend the past 5 years or 10 years in hospitals.
So in doing so, it's no medication. How do you lead them to go like that?
To start with, have to admit that 80% actually start from ourselves.
Okay.
If we don't want to getting sick, it's pretty much about lifestyle. That's pretty much everything that everyone can do. But another 20% is about the technologies, the medications, the supplements that are very popular right now. And I believe maybe one of you out there might be taking one or two or maybe more than one supplements.
Very interesting. And the Bamrungrad is a kind of a vital Wellness Center. You are, what is it a center core expertise? What is yours?
For the Vital Life Wellness Centers, we are the one of the, we can say one of the founder, one of the first wellness centers in Thailand. And right now, this year, we are going through the 13 years old already. Okay. But for the hospital, it's 33, going to 34 years old. So for the Vital Life Wellness Center, pretty much it starts from the belief in the anti-aging medicine or wellness medicine of the owner, because she also a working woman, and she wants to maintain the active lifestyle also. So it's come from the passion of the owner, and that's why I'm very happy to working here. And the service that we have pretty much is going to be about what we are going to talk right now, that how we can maintain our health to be at the maximum level as long as we can.
In getting into the process, what age one can come to you?
I think
to set it up?
Most of the people who have interesting in wellness right now is going to be late 30s. Late 30s. Up to the oldest patients that we have is around 90s.
90?
Have 90s also.
So
90s.
What is that 90?
90s-year-old have many type of patients. Some of them might have many chronic disease and feel very fatigued and want to have a better energy and be able to help him or herself. So in that case, we're going to take care with the conventional doctors or the attending physicians, and then plan that, okay, this type of exercise might be good for these patients, and if he or she needs certain supplements or not.
Very interesting. So is it scientifically possible to delay aging?
Definitely. For example, if you look at the classic disease of aging, actually very common in female is menopause.
Oh, yes.
Because menopause is the age that every female stops producing hormones or the female hormones, and you can see tremendous change in the physical and also the mentally. Yes. Both memory declines, you eat the same but you gain weight easier, your skin change, become very, very dry, and sometimes mood very swing. That's a very classic signs of the aging. And as you can see in the menopause female, when you use, for example, the hormone replacement therapy, most of those signs and symptoms, for example, like the cosmetic issues, those dry skin issues become better, the bone becomes stronger. So this is a very classic sign that actually the aging can be reversed or even delayed. But it doesn't mean that every people need to be on the hormone replacement. Doesn't mean that every people need to be on the supplements, because it varies, depends on each and every one of us.
So it also, if you consider, if a person, a lady, the age of like 60 something, can they're still not to go to that class, that kind of trouble, and what I mean, that means that the person is healthy on along.
Yes.
So,
what I can offer for them, right? For the anti-aging point of view, if you are healthy already, our goal is to help detect whether you have the risk to getting sick or not, because our goal is to prevent you from getting sick.
Great.
Number two, if you are 60 years old, you are in the menopause, you have active lifestyle, you never have bone fractures, your mood's very good. I mean, you take care of yourself very, very well, but still it doesn't mean that you will not have the risk to have osteopenia, osteoporosis, that increase the risk of the bone fractures. It doesn't mean that you don't have the risk for diabetes or don't have the risk for heart disease, because as we all know, after the age of the menopause, when we lose the female hormones, you lack of the hormones that help absorb the calcium. The bone start to become a problem, easy to get fractures, and also the memories declines easily. And most female that concern is about cosmetic issues, because you become to have like a very, very dry skin, dry hair, and hair thinning.
In your suggestion as a doctor, the person of that age should not get into the surgery to make themselves tighten up. Do they need it, or?
If you use the word necessary or not, have to admit cosmetic and wellness It's not a necessity. It's an option.
Option, yes.
For example, it's an option for you to be aging gracefully, or you can aging normally. So it's the option.
Okay.
But you cannot avoid aging, that's for sure. So for the cosmetic issues, I think, like most people say, the beauty is on the eyes of the beholder. So it depends at what is the definition of the beauties that you want. But it's not necessary. It's not necessary.
And that becomes necessary for some anyway. So what is the situation of the aging population in Thailand? Do you have the number? Do you have the figures?
The figures have to check again with the public health, Ministry of Public Health. I'm not sure, but if you look at life expectancy, we all know that the female have a longer life expectancy than the male, and right now on average is around 78 years old.
That's what I received some information from some men to ask why. Why do the women living longer? Is there any reason behind it?
I think it's many reasons, but with the joke they say the women die very difficult, unlike men. But partially it might be related with the hormones issue also. In a guy, they still have the sex hormone that called testosterone, even though is not disappear like the female who has menopause, but slowly it's decline, and when it declines, it increases the risk of heart attack in men much higher than in female, and maybe it's related with lifestyle also, like smoking, drinking,
and all that. So, and can you, I don't know whether can you classify it and let us know the major causes of death among the elderly? Is there
major cause
Can you
of death among
pinpoint for
elderly? Actually, I think in Thailand, the one that I know is still the number one is still the heart disease. I think all over the world is still heart disease and cancer. That's why if you look in the research or about the anti-aging medicines, these going to be the two main topics that people raising up, that how we can prevent the heart disease and how we can prevent the cancer or cure the cancer. That's I think the two leading cause of death all over the world.
The heart disease can be easily done, I think, but I mean protecting from cancer is a bit difficult because you can never know. Because there is no, is there any pinpointing out at what reasons that you get cancer?
To identify one only reason why you develop or have a cancer, I think we don't have the answer right now because it's multifactorial. But we all know that one crucial issues that really impact with the cancer is about immune or your immunities. If your immune is very good, it's acting like a soldier, and this soldier, they're gonna like survey all over your bodies and detect the abnormal cell or the bad guys. The cancer cell is act like a villains or the bad guys. If they notice that, okay, you have bad guys in the house and your soldier is very active, then it's gonna get rid of that bad guys instantly. Because if you look in some research data, actually our body, each and every one of us, have the cancer cell going on all the time. But because our immune is very strong and active, so we can get rid of that bad guys. But for those people who have cancer that become growing and have a disease like a tumor, we found that one crucial issue is their immune or their soldier is not healthy. They're not working well anymore. They're getting weak. That's why when they survey, they might not remember. Like when we are getting old, we say, oh, who's that? I'm not sure, maybe you're not the bad guys, and then I just walk away. So then it let the bad guys or the bad cells growing and develop into the cancer. And it's one of the hallmarks that when the cancer grow very big or in the advanced stage, it also suppress the immune function in the body also. And I think immune is one of the very crucial issues for the wellness right now. As you may know, not only the cancer, but many viral infection, as you can see right now from the coronavirus, like MERS, Middle East, and before that we have SARS. So the immune is one of the crucial items that are going to help maintain your quality of life.
So at Bamung Hospital, this illness department, the increasing of the immune is it normal, or is it complicating? One have to do what? to increase
I
it?
think mainly pretty much we're going to go back to the basic, pretty much about lifestyle. In order to
Okay.
maintain a healthy immune or the healthy life, number one, very basic and simple, is about what you eat.
Okay.
You are what you eat. And number one is they say, some people believe in the caloric restriction. That means you should not eat too much.
Of everything.
Most common recommendation, they say you should eat around 80%. That gonna make you feel full, not like
Not 100%.
not 100% full.
110.
Yes, and another side that you should like observe for yourself is whether you eat too much carbohydrates or not, because too much carbohydrates gonna turn into the fat
Sugar
and make
fats.
you not only gaining weight, but
yes.
also it's gonna make increase the risk of diabetes also. One classical sign is if you eat and then you feel sleepy afterwards.
Okay.
Within 30 minutes to 2 hours, that means the tendency that you eat too much carbohydrates in that meal is very
Really?
high. Yes,
Oh,
because the
that's good to know.
carbohydrates will change into the certain neurotransmitter we call the tryptophan, and it make all of us sleepy. But if in a small amount, it make you feel good. That's why most people, when they feel like anxieties or get upset, they love to eat sweet stuff.
That's what they tend to be expanded because of the I'm worried.
Yes,
I'm
and
this
you
thing.
addicted to the sugar.
Addicted.
So number one, you eat only 80%
Okay,
to make you
number
feel
one,
full,
Yes, 80%. Yes.
and try to avoid too much carbohydrates. So after you eat, you should have energy, but not sleepy. If sleepy, then mean too much carbohydrates already. Number three, we always say to eat like the rainbow colors, because the antioxidants that are very popular like astaxanthin, vitamin C, carotenes, actually it's available in those vegetables and fruits. So each multiple colors, use lots of colors on your food plate, not only green veggies, because the green color give you certain vitamins and antioxidants, but not 100% complete.
So what is the best way for dieting or exercising for the older people?
For the older people, I think for the nutrition is like I mentioned earlier, but the most common pitfall for the elderly is the protein.
Protein, yes.
Number one is because the protein is more difficult to digest than carbohydrates. And maybe older people, some people have the problem with the gum and teeth, so they don't want to chew that much. But as you know, protein usually come from like chicken, those meats,
Better than, yes.
white eggs, and actually you can choose the alternative source like from beans and lentils also. But I recommend to be mixed between both, because certain amino acid or the protein you cannot find in the crops or in the beans and lentils. For the exercise for the elderly people, I think the best way is just walk.
Oh, okay.
No need
How
to use
fast?
any fancy instrument. The fast
Doesn't matter.
Doesn't matter. I'd recommend to monitor your heart rate. Some people gonna recommend to like
Swing
your
the hands.
arms also, but when you swing the arms, it need to be very, very careful in patients with heart disease, because it increase the load of the heart quite a lot. So just simple walking, but we recommend at 10,000 steps per day.
10,000?
10,000 steps. Would you like to guess how many kilometers?
The step up like that?
Yes, just step.
10,000
steps.
It's not a little bit. It takes about 2 hours.
10,000 steps is around 5 kilometers.
Okay.
And I think the best pace should be within 50 minutes to 60 minutes.
Interesting. So what are you recommending to take supplementary food and like perhaps the Thai herbs?
The Thai herbs have many evidence in the many papers that are very, very good. Like we always say, it's like the old wisdom. So it's not bad. But the problem is when you use without knowing the risk and side effect, that the herbs can have the interaction not only with the food but with the current medications that you are taking. That's why you need to be very, very be careful. So on the general recommendation, I don't encourage everyone to just go on the drugstores and buy supplements. Or your friends say, this one is good, please take this one because I take this one and I feel good. one thing that good for me might not be good for you.
Oh, yes.
And like I mentioned, the way to know whether you are lacking the certain vitamins or not, if you do your diary, that include the food diary also, you can use some programs to analyze which kind of nutrition that you're lacking of. But if you want to know exactly, the best way, just go to see the doctors, have some simple blood tests, and see that what is the items that your bodies really need. And if you cannot adjust with your lifestyle or your nutrition because we eat according to emotion most of the times, then you will know that which supplements that your body really need. So the overtaking of supplements never be good.
So far seems to be so good from the Bamrungrad Vital Wellness Center. How many number of the old age that been improved in your hand?
I think most of the patients, I cannot remember the number exactly because I didn't keep track, but I always enjoy keep seeing the same patients come to see me every year, like for the annual checkup, and they smile and getting healthier.
I see.
And most of the time, they're going to bring friends and families to see and said, doctors, can you help others to feel better also? So I think that the thing that I'm proud of, and that's why we still have these wellness centers.
So in your, what is the highest age in your hand that you've been
90s.
90 that you said.
90s.
How many 90s?
How many 90s? Just couple.
So the 90s still on and on, still
Yes,
going on.
yes.
They don't seem to be.
No, still very active,
Yes,
even though she has like a chronic heart disease, chronic kidney disease, but she's still very active. Still very
It
active.
depends on you must be rich. A person must be wealthy, well off to go through into such a center.
Like I mentioned, for the wellness centers or the anti-aging, if you focus only on those 20% that require the advanced technologies for the blood tests and need to use a certain supplements or medications that very rare, then those 20%, yes, you need to have some power to buy, to enter in that 20%. But the 80% that I mentioned that related with lifestyle, you don't need any fancy amount of money. You don't need any to have rich people to support you, but it's at yourself that whether you decide to become healthier or not. If you decide to become healthier, those 80% start with your lifestyle, from eating, from exercise, walking, from sleep, and from relaxing and how you choose to cope with the stress.
How many domestically and foreign or international patients come to you?
If in Bamrungrad International, you have to admit that Bamrungrad International or Vital Life is called international. So pretty much we have both international patients and local patients. In the Vital Life, pretty much 50% and 50%. And emerging populations tend to be in the AEC, in our neighbors, especially Myanmar.
Okay. Oh, Myanmar coming. Oh,
Yes, Myanmar is very quite a lot of Vietnamese and Chinese. That is the growing population.
Yeah, very interesting. I need you to come back again, because we have time, such a too little time for this. But next time we're going to hear more about what do we do, because the world has been changing. So Thailand Today would like to thank Dr. Wan Viput San Pasitwong, Vital Wellness Center, Bamrungrad International Hospital, who briefed us about her work and medical expertise available at the Wellness and Anti-Aging Center. Aging is nothing new, and yes, it could be think of the past. Thank you, Doctor, for being here.
Thank you.
Thank you for watching Thailand Today. I'm Kusuma Yotha Samut. We hope to see you again tomorrow. สวัสดีค่ะ